Flores and work nights on PCU. As some of my coworkers have already touched on already, there's always going to be issues in hospitals. The big thing for me is finding the appropriate pathways and avenues to help solve these issues. As nurses, we have the patient's best interests at heart, as I'm sure you can tell just by listening to Janet and Sue. And we need to be able to advocate for them and for ourselves as well. And we shouldn't have to be fearful of repercussion to be able to do so. Coming together as one and forming a union will give us the voice and the appropriate platform to discuss these problems and find a more constructive way to bring better patient care and nurse satisfaction in a timely manner. I know myself, as well as everyone else, join these committees, you do everything you can, and it just seems like nothing ever happens. And so doing this, we really feel like there's got to be a timeline involved as well. And we're here because we feel like we can create something special. One of my coworkers told me one night that she had a job at a different hospital, but she stays at Inspira Woodbury because of the people that she works with. And I wholeheartedly agree. You know, we have a very educated, strong, dedicated workforce, and coming together with HPAE, really feel we can rejuvenate the hospital and bring back the respect and prestige the hospital rightfully deserves.
Hi, my name is Amy Chu. I work in the intensive care unit on the night shift. I feel like I grew up in this hospital. I was born there. My mom worked at the hospital for 36 years before she retired. I've been a patient at the hospital. I've been a candy striper, a nurse's aide, a nurse extern, and now I've been an RN there for 19 years. So I feel like this hospital has been part of my entire life, and it's very, very important to me. I've seen a lot of changes over the years at the hospital, some good, some not so good. One of my stories is I'm a designated charge nurse at times at the hospital, so I feel like I sort of have the weight of the unit and the rest of the hospital sometimes on my shoulders. Recently, the hospital did away with our IV therapists at night. Every RN can put an IV in, and we take great pride in that skill, but the patients these days are a lot sicker. And when they're up on the floors and they need an IV and they can't get it, the nurses call the ICU as their support. And as a designated charge nurse, I need to go up there and try to help them. At times I feel very torn between taking away my time from the unit and needing to go up there and help them. And it's just something that we need to keep the care on the patients, the focus on the patients. It's just those little things that have changed that, you know, really make us want to stand together so that we keep all the patients, you know, safe. We are fighting to have a voice in the hospital to do just that. We can't stand alone in this fight. We thank you very much for coming today and supporting us. We know we have a big fight ahead of us, and having everybody here today just makes us feel a lot stronger. Thank you.